This segment of CoastLife is sponsored by Beebe Healthcare.
Leah, you and I have been known not to be runners.
No.
No, it's not to say we're not active. We just are active in different ways. We prefer a more subtle approach.
Yeah, if we're running, something's probably chasing us. So
yeah.
you better
Run
be running
with us.
too.
Yeah, exactly. But what I can get behind is walking.
Oh, well, I could walk all day.
Yes, good. Well, that's good news.
Yay.
Hopefully you guys can too, because National Walking Day is coming up. How about that? To tell us a little bit more about what it is, why is it so important, we have our friends Thomas and Tracy back with Beebe Healthcare. Thank you guys for being here today.
Thank you for having us.
Yeah, happy to have you guys back. So, Walking Day. It might sound silly to some people. What the heck? It's just a day about walking. But why is it so important?
All right, so April 3rd is National Walking Day. It has been around with the American Heart Association for the last decade or so. And what we really want to do is promote the idea of avoiding a sedentary lifestyle, right? So what that looks like is for every 8 hours that you're sitting at your desk behind a screen, perhaps like most of us post-pandemic, we want to make sure that you're at least attempting to get close to 60 minutes worth of exercise and walking ideally, if you can.
Okay, interesting.
Awesome.
So I want to talk about that a little bit more. You kind of said this 8 hours of maybe sitting at a desk. Some of us might think like, oh, we're fine, because I'm at work, so I'm doing something. We sit either on the couch or at our desks a lot.
There's a lot of sitting involved in a lot of jobs. And I mean, this is one where we're not necessarily tied to the office, but even when we get to where we're going, guess what? We're sitting.
We're sitting again. How can people stay walking at work or at home?
Just walking around the office.
Taking some laps.
Yeah.
Right, exactly. It's always, a lot of folks these days use some sort of virtual platform for their meetings, so it's great. You get your ideas actually flowing a little bit more easily. In fact, when you are moving around, when you're exercising, you're releasing endorphins, you are creating new neural pathways now. It's called neurogenesis, right? So when that happens, actually, your ideas become a little bit more brighter, more crisp, more clear. And actually, the risk increases if you're sitting for close to 10 hours a day. It increases your risk of coronary artery disease and cardiac events.
So, Tracy, I know you know a lot about hearts, our physical hearts. So, if someone maybe they're not very fit, maybe they know that they don't have the best health, or on the opposite side, maybe someone just thinks, I'm fine, I don't need to walk. How big of a deal just simply walking? How much does that really do for us?
It is a great way for us to get some aerobic exercise. One of the things I always like to tell patients is to make sure you're walking at a pace where we could have a comfortable conversation. So if we were walking and talking together, we would be able to talk without being very short of breath. The other big thing beyond just the aerobic benefits is just the mental health benefits, the stress release component of going for a nice walk and being outside when the weather does cooperate.
Yeah. I mean, I think it's a great way or a great thing to even work into your afternoon activities, because I feel like sometimes, you sit at your desk all day, you go home, you're so tired from being stressed. What do? You plop down in front of the TV or the computer or your phone, and what do? We sit some more. So I think
and then you go to bed.
Making that because I have noticed a difference. I've been doing a little bit more working out in the afternoon, and I'm like, my brain is back.
Yes, it's wild. So people can already start preparing now for November with the big events coming up. Tell us about that.
Sure. November 6th is our centennial event for the American Heart Association.
Wow.
We're doing our Heart Walk this year. In relation to that exercise that you want to try to acquire, up till November 6th, is that we're looking at 150 minutes a week, approximately, of light, moderate exercise, right? So brisk walking. If you're able to do 75 minutes of vigorous activity, that's what we really want you to push for.
Okay.
So that looks like maybe a little bit more of a heavier duty jog, maybe biking uphill, even though we're in Delaware, there aren't too many hills. But if you go to Cape Henlopen State Park, you could certainly find a couple there.
Yes, there are quite a few hills.
Yes,
So
very
it looks
good
like we
point.
got some goals.
Yes, for sure. Before we let you guys go to, if anyone is concerned about their heart health or anything like that, you were letting us know something that Beebe offers.
Absolutely. We have a fantastic cardiopulmonary rehabilitation program. I'll let Tracy speak to that.
Yeah,
a little
please.
bit.
Yeah, so for any patients that have any heart disease, they are eligible to join us for cardiac rehab, where we have an opportunity to monitor their hearts and monitor their symptoms and make sure they can progress into that normal exercise.
Great. Wow. Thank you for what you guys are doing for the community, getting us walking out and about. So guys, start looking forward already to November, that Heart Walk. That's going to be a lot of fun. I think we should make a goal every week.
I think so too.
To walk a little bit more.
We'll hold each other to it.
Yes. Well, yes, we'll try it for sure. All right. Well, thank you guys again. You guys can get to walk in your living room a little bit. CoastLife. We'll be right back.